Hey everyone, and welcome back to the Deep Dive. You know how much we love digging into the latest and greatest in AI? Well, today we've got a really exciting one. We're talking about AetherAI. This brand new platform is making huge waves in the world of digital pathology. In fact, it just launched today, January 4th, 2025, and it's already trending like crazy.
It really has captured everyone's attention, hasn't it? And what I find particularly interesting is the team behind it. They've got this incredible mix of physicians and data scientists, which tells me they really get it. They understand both the medical needs and the tech possibilities.
It's not just tech folks building something in a vacuum, right? They're
Yeah.
coming at this from the perspective of actual medical practice. And that really seems to be reflected in their whole approach. What I thought was so interesting was how AetherAI is being described as a complete platform, not just a single AI tool.
Yeah, exactly. Their goal is to integrate AI into every single step of the pathology workflow. Pretty ambitious. This is what really sets them apart from companies like PathAI. They're doing fantastic work, but tend to focus on specific tasks within pathology.
So it's less about adding AI as a separate thing and more about making it the foundation for the whole process. Speaking of foundations, one of their products that really caught my eye is aetherSlide.
Ah, yes, aetherSlide. Basically, it's a digital pathology workflow system. But the key here is that it's vendor neutral. So pathologists can integrate it with whatever they're already using. No need to rip and replace everything, which can be a huge obstacle.
Yeah, it could be a nightmare to implement new tech, especially in a busy lab. Seems like they really thought about that. But let's talk about the AI itself, because that's where things get really interesting. They're using something called True GigaPixel AI. And I'll be honest, it sounds a little sci-fi to me.
It does have a certain ring to it, doesn't it? But it's a pretty significant advancement. You see, traditional AI models in digital pathology have used patch-based methods. They analyze small chunks of an image at a time. But True GigaPixel AI uses the entire whole slide image, which can be gigapixels in size.
So instead of looking at pieces of a puzzle, they're seeing the whole picture. What kind of impact does that have?
Well, there are two main things. First, it eliminates the need for those incredibly detailed annotations, the ones that were required for the patch-based approach. Saves a ton of time and effort. Second, by training on the entire image, the AI gains a much richer understanding of the context, and that leads to greater accuracy.
That makes sense, right? It's like the difference between reading a paragraph and reading a whole book. You get so much more depth from the complete work. So we've got this powerful AI looking at these huge detailed images. What can it actually do with that information?
Well, they've developed a suite of AI-powered tools that are built on this technology. For example, they have a tool for slide quality control. The AI can actually flag a blurry or poorly prepared slide, so pathologists don't waste time on images that won't yield accurate results.
That's got to be incredibly useful.
Yeah.
Any other tools that stand out to you?
Oh, definitely. There's also case triaging. The AI can help prioritize urgent cases by identifying the ones that need immediate attention. This can be especially helpful when there's a backlog of cases.
So it's not just about making the analysis more accurate. It's also about making the whole workflow more efficient. And speaking of efficiency, they've also applied this tech to very specific areas of medicine. See, I was reading about AetherAI Endo and AetherAI Ortho.
Oh, yes, those are fascinating applications. AetherAI Endo is being used for colonoscopies. It actually uses AI to detect colorectal polyps in real time during the procedure itself.
Wow, that's incredible. What does that mean for the patient and the doctor?
Well, it means polyps can be identified and removed immediately, which could prevent them from developing into cancer. Early detection is key when it comes to cancer, so this could have a huge impact.
So it's not just about diagnosis, it's about intervention as well. And what about AetherAI Ortho?
That one focuses on orthopedic diagnostics. It automates the measurement of whole spine lateral images. These are essential for diagnosing and monitoring spinal conditions, but they can be so time-consuming for specialists.
So AetherAI Ortho is taking that burden off their shoulders.
Exactly. It frees them up to focus on other aspects of patient care.
It's like they looked at the most time-consuming tasks and said, let's have AI do this so the humans can focus on what they do best. But it's not just about the tools themselves, is it? They also have this web-based platform called aetherWeb.
Ah, yes, aetherWeb. It's all about collaboration and knowledge sharing. It's a platform where medical professionals can access curated slide collections, share interesting or challenging cases, and learn from each other's expertise.
It sounds like a fantastic resource for both experienced pathologists and those still learning. But I'm curious about the implications of this kind of open access. Could it change the way pathology is taught and practiced?
It really could. It has the potential to democratize medical education. Imagine medical professionals, regardless of their location or resources, they can access this wealth of knowledge and learn from leading experts.
That's an exciting prospect.
Ooh.
But as with any new technology, there are bound to be some challenges and concerns. What are some potential downsides to this kind of widespread AI integration?
Well, one concern is the need for serious computational resources to run these AI models. Smaller institutions or hospitals with limited budgets might struggle to implement this technology.
That's a good point. Access and affordability could be a real barrier. Any other challenges that come to mind?
Another one is the learning curve for medical professionals. Integrating AI into their workflow is going to take time and training. And some folks might be resistant to change or intimidated by the new technology.
It's like anything new, there's going to be an adjustment period. But it seems like AetherAI is trying to address these concerns by making the platform as user-friendly as possible.
They are, and they're also exploring partnerships to make it more accessible. It's encouraging to see them tackling these challenges head-on.
Absolutely. We've covered a lot of ground here, from True GigaPixel AI to the very human implications of AetherWeb. AetherAI is clearly pushing the boundaries of what's possible in digital pathology. But where do you see this all going? What's next for AetherAI and for the field as a whole?
It's hard to say for sure, but I think we're only just beginning to see what AI can do in pathology. AetherAI's approach with the whole platform idea and True GigaPixel AI, it's definitely setting a new standard.
It feels like a turning point, doesn't it?
Yeah.
Like we're on the verge of a major shift in how pathology is practiced. Thinking about all the different applications we talked about, colonoscopies, spinal measurements, it makes you wonder, what are the implications for healthcare as a whole?
That's a great question to ask. If we step back and look at the bigger picture, AI has the potential to tackle some of the biggest challenges facing healthcare today.
Like what kinds of challenges?
Well, for one, there's the issue of increasing demand and limited resources. We've got an aging population, a growing number of chronic diseases, and not enough healthcare professionals, especially in specialized fields like pathology.
Right, and that leads to delays in diagnosis and treatment, which can have a huge impact on people's health.
Exactly. But AI can help fill that gap. By automating routine tasks, improving accuracy, and streamlining workflows, AI can free up healthcare professionals to focus on the more complex and nuanced aspects of patient care.
So it's not about replacing human expertise, it's about enhancing it.
Exactly. It's about creating a system where technology and human expertise work together to provide the best possible care.
And that brings us back to AetherAI. By developing these tools and making them accessible to more institutions, they're really contributing to that vision of a more efficient and effective healthcare system.
Absolutely. And I think the impact will be felt not just in pathology labs, but throughout the whole healthcare ecosystem. Imagine a world where diagnoses are faster, more accurate, and treatments are more targeted and effective.
That's a really exciting thought. But it also brings up some important questions. For instance, what are the ethical considerations surrounding AI in healthcare? How do we ensure that these technologies are used responsibly and benefit all patients regardless of their background?
Those are crucial questions that we as a society need to address. As with any powerful technology, there's always the potential for misuse or unintended consequences.
Which is why it's so important to have open and honest discussions about these issues. We need to involve not just the developers and healthcare professionals, but also patients, ethicists, and policymakers in shaping the future of AI in healthcare.
Absolutely. I completely agree. It's our collective responsibility to ensure that AI is used ethically and effectively to create a healthcare system that is truly fair and accessible to everyone.
It's a complex landscape, no doubt, but it's also incredibly exciting. And AetherAI, with its innovative approach and commitment to collaboration, seems to be playing a key role in shaping this future.
They really are. And it'll be fascinating to see how their technology continues to evolve and impact healthcare in the years to come.
Speaking of impact, I think it's worth highlighting some of the specific ways AetherAI is already making a difference. We touched on AetherAI Endo and AetherAI Ortho earlier, but let's dig a little deeper into those examples.
Sure. Let's start with AetherAI Endo. Detecting polyps in real time during a colonoscopy isn't just about efficiency, it's about potentially saving lives. Colon cancer is one of the most preventable types of cancer, but early detection is absolutely crucial.
And the traditional method of just visually inspecting the colon can sometimes miss small or flat polyps.
Exactly. But with AetherAI Endo, the AI is continuously scanning the images, looking for even the slightest abnormalities. It's like having an extra set of highly trained eyes assisting the gastroenterologist.
And that can make a huge difference catching a polyp early versus dealing with a much more serious situation later on. It's all about giving patients the best possible chance.
Exactly. And it's not just about cancer detection.
Hmm.
AetherAI Endo can also help identify other issues in the colon, like inflammatory bowel disease or diverticulitis.
So it's a versatile tool that can improve diagnosis across a range of conditions. Yeah. What about AetherAI Ortho? What kind of impact is it having?
Well, spinal conditions are incredibly common, and getting accurate measurements of the spine is essential for diagnosis and treatment planning. But manually measuring those images can be so time-consuming, and there's always the chance of human error.
So AetherAI Ortho takes care of that for the orthopedic specialist.
Exactly. It automates the measurement process, ensures accuracy and consistency, and frees up the specialist to spend more time with the patient talking about their condition and treatment options.
It's really about putting the patient at the center of everything. And that seems to be a recurring theme with AetherAI, from their focus on user-friendly design to their emphasis on collaboration and knowledge sharing.
You're absolutely right, and I think that patient-centric approach is what truly sets them apart. They're not just developing technology for the sake of it, they're developing technology that can truly make a difference in people's lives.
It's inspiring to see a company so dedicated to making a positive impact. But we can't ignore the fact that AI, like any technology, has a potential for both good and bad. What are some of the risks or ethical concerns that we need to be aware of as AI becomes more common in healthcare?
That's an important question and one we should definitely discuss. One of the biggest concerns is the potential for bias in AI algorithms. If the data used to train the AI is biased, the AI itself will be biased, which can lead to unequal care.
So, for example, if an AI model is primarily trained on data from white patients, it might not be as accurate at diagnosing conditions in patients of color.
Precisely. And that's just one example. There's also the issue of data privacy and security. Healthcare data is incredibly sensitive and needs to be protected from misuse or breaches.
And there's the question of transparency. How do we ensure that these AI systems are explainable, that we understand how they're making decisions, and can hold them accountable for those decisions?
All of these are complex issues that require careful thought and collaboration between technologists, healthcare professionals, ethicists, and policymakers. We need clear guidelines and regulations to ensure that AI is used ethically and responsibly in healthcare.
It's a lot to consider, but it's a conversation we need to have. The potential benefits of AI in healthcare are huge, but we also need to be aware of the potential risks and take steps to minimize them.
I completely agree. It's about striking that balance between innovation and responsibility, pushing the boundaries of what's possible while making sure those possibilities benefit all of humanity.
It's a big challenge, but I'm optimistic that we can do it. And I think companies like AetherAI, with their focus on transparency, collaboration, and patient centricity, are setting a good example.
They definitely are. And it's inspiring to see so many people and organizations working towards a future where AI is used to create a healthier and more equitable world.
Well said. We've covered a lot of ground in this deep dive, from the technical details of True GigaPixel AI to the ethical considerations of AI in healthcare. It's clear that AetherAI is a company to keep an eye on, not just for their innovative technology, but also for their thoughtful approach to the challenges and opportunities ahead.
I couldn't agree more. They're a major player in the world of digital pathology, and I'm excited to see what they do next.
Me too.
But before we wrap things up, I want to turn it over to you, our listener. We've explored the technical side of AetherAI, the potential benefits, and some of the ethical considerations. But what are your thoughts?
What aspects of AetherAI stand out to you? What are your hopes and concerns about AI in healthcare? We'd love to hear your perspective.
This has been such a fascinating look into AetherAI and the world of digital pathology, hasn't it? We've seen how they approach the platform, the True GigaPixel AI. It's really shaking things up.
Yeah, it really is.
Yeah.
And we've also talked about some of the bigger implications of AI in healthcare, both the potential benefits and those ethical challenges. It's definitely complex, but there's so much potential for improving patient care and changing how we think about medicine.
Absolutely. And like we've been saying, it's crucial to have these conversations to really think about the impact of AI and make sure these technologies are developed and used responsibly.
It's not just on the developers and doctors either. It's on all of us, patients, ethicists, policymakers, everyone who's going to be affected by these advancements.
Right. It's a shared responsibility.
Exactly. And that's why we want to hear from you, our listeners. What are your thoughts on all this?
What parts of AetherAI stood out to you? What are your hopes and concerns about the future of AI in healthcare? We really want to hear your perspectives.
You can use the hashtag AetherAI and tag us AI for the people on your favorite platform.
We're really interested in what you have to say, your hopes, your concerns, because the future of healthcare, it's something we create together through these conversations.
So as we wrap up this deep dive, we'll leave you with one final thought. If AI can handle the routine stuff, the repetitive tasks, the things that take up so much time, what does that free up human medical professionals to do?
What new possibilities open up when we combine human expertise with intelligent machines?
It's something to think about, a future we can help shape. And I think with careful thought, open collaboration, and a commitment to ethical innovation, we can use AI to create a healthcare system that's truly patient-centered, equitable, and transformative.
Couldn't have said it better myself.
Thanks for joining us on this journey into the world of AetherAI. Until next time, stay curious, stay engaged, and keep diving deep into the amazing world of AI.